Your young to middle-aged dog has started to limp on her front leg. She may have elbow dysplasia and elbow arthritis. Find out what it is and what you can do in this video. Hello, welcome back to my channel. If you're new, welcome. I'm having an upcoming webinar, Dog Health and Nutrition. All you need to know about what to feed your dog and some of my top natural home remedies. If you're interested, I'd love for you to come. You can click the link in the box below for more information. Elbow dysplasia is a condition that causes pain, swelling, and eventually elbow arthritis. Typically, it's seen in our medium to larger breed dogs. Often when you can see signs as early as 4 to 5 months. This is Pippi's left leg. This is her elbow here. And what you have is you have two big bones on the front here, the radius and the ulna. And they articulate with the big bone that makes up the shoulder joint here, the humerus. If Pippi were to have elbow dysplasia, elbow arthritis, first of all, it would be painful for me just to put any type of pressure or squeezing this elbow joint, especially on the outside and the inside of the elbow joint. It would be painful for me to extend it and flex it. Often on palpation, especially in the veterinary practice, I would actually feel the elbow to be visibly swollen. And that's what you may or may not expect to see if your own dog had elbow arthritis. So pictured there is the anatomy of a dog's elbow joint. And in it you can see this notch called the ulnar notch. You can see how that sort of articulates and joins the humerus and how a normal elbow should look. In elbow dysplasia, you can have maybe a thing called a fractured medial cornoid process, which is pictured there. You can have a thing called a UAP, an ununited anchineal process. And you may also have a thing called OCD or osteochondritis dissecans. Ultimately, if it's not treated, you've got a lack of articular cartilage. You're going to be left with bone rubbing on bone and elbow arthritis. If your dog has this condition, here are 5 holistic options that you should be considering. First, in my opinion, every dog that has elbow dysplasia, elbow arthritis, should be on a good quality joint support supplement. And in particular, you should be focusing on these 3 key nutrients: glucosamine, chondroitin, MSM. I have a specific joint support formula, Dr. Jones's Ultimate Canine Advanced Health Formula, and in it I have therapeutic levels of those 3 key nutrients. Second, I want you guys to consider acupressure. So acupressure is related to acupuncture, but obviously we're not going to see a Chinese medicine practitioner and we're not putting in acupuncture needles. But what we are doing is we putting our fingers, we're putting pressure over top of those key acupuncture points. And in many cases, and in many of our dogs, that can actually give symptomatic relief at home. It can actually help your dog feel so much better. If you had the option to go a Chinese medicine practitioner or a veterinarian that's trained in acupuncture, I think that would be great. But most of us don't have that option. The key acupressure points for the elbow, we're dealing with the 2 points that run on, one is on the outside, one is on the inside. There's LI10 and LI11. So LI10 is on the outside of the elbow joint, and you actually feel when you move the elbow up and down, you feel just on the outside of the elbow joint, you're going to feel a little point of the bone. That's the LI10. And if I take Pippi's right elbow, on the inside here, you feel a little point. And that's the LI11 point. So what you're doing is you're putting your thumb, your index finger over top of both of those points. You're going to put moderate pressure, hold that for 30 to 60 seconds. What I suggest is doing that twice a day. Do that for a full 7 days and just see if it's giving your dog any benefit. Third is a supplement that I've discussed throughout many of the YouTube videos, And I think it's really, really important for any of our dogs that are dealing with elbow arthritis. It's this one, it's the 95% curcumin. When we're looking at doses of the curcumin, we're looking at 100 milligrams per 10 pounds of body weight, once to twice daily. For Pippi's size, she's about 50 pounds, she get about 500 milligrams. And I would start her at once a day, then up that to twice a day, assuming she's able to tolerate it, no vomiting or diarrhea. Secondly, it's really important that it's given with fat, because it needs to be bound to something to be absorbed. Fourth, I wanted to show you a new sort of topical treatment, which I haven't shown in the past for dogs with arthritis. In particular, elbow arthritis is a really great option. So I've got two things here. First, this product here is called DMSO, and it's a topical liquid that penetrates really readily in through the skin. I used it in veterinary practice. We use it to actually bring in certain medications into an affected joint. You know, say try to bring in something like lidocaine, a topical anesthetic, into a dog that's had knee surgery. A really great option, I think, for a dog with elbow arthritis would be using topical DMSO. It can be used as a single agent, and it will actually help decrease joint inflammation. Real great natural topical option. As well, too, I think it would work really well in combination with CBD oil. So here's my CBD supplement, Dr. Jones's Ultimate CBD for Dogs and Cats. The DMSO dose is approximately 1 ml per 10 pounds of body weight. Pippi is 50 pounds, meaning she gets 5 mils or 1 teaspoon. I'm just going to measure it out here just to see, here Pipster, about what 5 teaspoons is for a dropper, because Pippi wants to eat everything. Looks like that for this bottle, everybody's bottle is going to vary. Look, it's about, yeah, each dropper is about 1 ml. So it's about 5 droppers full. So first we would put on the 5 drops or whatever your measured amount is of CBD. You can put that onto your skin and just rub that onto your dog's joints. For Pippi, I'm going to put on 5 drops for her. Then we've pre-measured out, that's 5 mils or 5 dropperfuls of the DMSO. And I'm just going to sort of pour it on the side. It's a good test for me just to see how this works. Yeah, it's liquid clear, but it looks like it gets readily absorbed. The other big suggestion is, you know, after you do this, you rub it onto your dog's joint. You're going to wash your hands well, so you're not absorbing all of it well. So there it is, rubbed in, Pippi. The suggestion is we could do that twice a day. You could do that, you know, sort of as needed, or do that for a week and see if it's beneficial or not for your dog. And now I'm going to wash my hands. The last remedy I want to discuss is physical therapy. So first, if you have access to a veterinary physiotherapist, someone who's comfortable post-op surgery-wise, perhaps you're even near a place that offers hydrotherapy, that would be great, like someone who can deal with canine rehabilitation. But if that's not the case, here are some simple things to start to think about. So first of all, if you've got access, if it's summertime, you get access to the water, if you've got access to a pool, the more swimming you can get your dog doing, the better. The biggest thing we're trying to do, and as you can imagine, say your own elbow is affected, you're trying to build up the supporting muscles. So imagine is putting pressure on your, your front right or left arm. You're my right arm. And if I just try to hold myself up with my elbow, it really hurts. But if I've built up my shoulder muscles, guess what? So I've got these stronger deltoids, I've got stronger biceps and triceps. I can hold my arm up and I don't have to put near as much force on my elbow joint. So much those same principles are going to be applying to your dog. So no, you can't get your dog. We're not going to get Pippi into CrossFit, have her start building up those joints, but there are some things we can start doing at home. Next, I really encourage you to try to get some form of hydrotherapy where your dog is in, even if it's the bathtub, You fill that up. I know it'd be kind of a pain in the butt, but at least they're in there supportively. Because what it does, it allows them to, it's supporting their body, but they can start using some of those muscles, extending and flexing the elbow joint, extending and flexing their shoulder joint, going through that range of motion, building up those muscles. Lastly, we're going to attempt to do an exercise in which Pippi is going to put her front paws on the wobbly board and try to balance on them, and I'm going to entice her with the treat. The principle behind it is that, you know, she has to start to stabilize her core, use the muscles of the front legs, and she's going to help to really build up those shoulder muscles, those muscles that are supporting the elbow joint itself. And it's one of the exercises that the physiotherapists that are using post-elbow surgery for dogs that have had surgery for elbow dysplasia. So wish us luck, Pippi. Let's see how this works. I'm glad that I was able to find this little wobbly board. Okay, Pippi. Good girl. Okay, let's see. We're going to get you to sit on. We're going to imagine that the pillow here, we're going to imagine that this pillow is a bit of a round ball, which is a little bit not totally balanced. Then we're going to get your legs, yes, on the, okay, is this working? You got to get your feet on here, Pipster. Good girl. We're going to get your feet on here. You're going to sit up. No, you got to sit up and not on. Good. Oh, yes. Okay, now. Yes. Oh. Whoa, we're not super balanced. I don't know how well this is going to work. It seems great in principle, though, doesn't it, Pippi? Good girl. Okay, I don't know. Well, you're getting some food. I don't know if we're strengthening your elbow, your shoulder muscles or not. Good girl, Pippi. Okay, you kind of got it. Okay, let's try that. Whoa, your core. We're not gonna. Oh, this side. This side. Okay, can you shake a paw? Can you give me a paw to shake? Good girl, Pippi. Oh, whoa. How about this side? Okay. Good girl, Pippi. Whoa. Good girl. There. So based on that little trial with Pippi, maybe the wobbly board is better for people to work on your balance and your core. I think the idea is a similar thing with dogs. But as you can see, just because it looks easy in the rehab video doesn't mean that it's gonna be easy to replicate at home. But thanks, Pippi, for being a good sport. Thanks so much for watching this edition of Veterinary Secrets on elbow dysplasia and elbow arthritis in dogs. I'm having an upcoming webinar, Dog Health and Nutrition, what you need to know about feeding your dog, and some of my top natural home remedies. I encourage you to come. You can click the link in the box below for more information.